Welcome back, guys. So on today's video, we will be discussing a very popular condition amongst veterans as well as myself, also the back. And so to start off from a rating standpoint, the back is rated in 3 increments. You have thoracic spine, cervical spine, and thoracic's in the middle, cervical's at the top. You have the lower spine. Today we're talking about the entire spine. We will be discussing exactly how the VA rates it, and we also will be joining with Dr. Nguyen today to discuss medically of what this means. And so Dr. Nguyen serves as our medical doctor here in the firm. She's an amazing brain behind the medicine of how veterans can get service connected. So without further ado, the back. Tell me about it. It's a popular issue. Folks, they definitely hear about how to get their back connected. Medically, what does this mean? How does the back injury happen?
Yeah, to try to keep things simple for a complicated topic. So pretty much your spine is made up of bones called vertebrae. The spinal cord runs in the middle, in the central canal of the vertebrae. There's an opening in the center. And so nerve roots are coming off of the spine out of the vertebrae to the rest of your body. And blood vessels are going into the spine to supply it with nutrients. So pretty much along these openings where the nerve roots are exiting the vertebrae, the bone, the openings can be obstructed in some way. So maybe you have like the bone part of the vertebrae, like bone spurs can be affecting the nerve roots. They can be compromised by lack of supply to the spine, and the nerve roots can become pinched or damaged. You know, just a lot of different ways to affect the nerve roots. But essentially just think that nerve roots being obstructed or affected in some way by damage around it can then result in weakness, numbness, tingling, things that you see commonly in radiculopathy, which is just the nerve symptoms. Radiculopathy in the back is also called lumbar radiculopathy, so you'll see that term a lot. It's also called sciatica because the sciatic nerve root is a really large nerve root and often is involved in causing the back pain and those symptoms.
So essentially, so veterans can understand this, if you have a back condition, the lumbar radicular pain, it runs from the bottom of the back to the top of it. How does this all work together? The nerve, how does this all happen?
Yeah, so pretty much there are just nerve roots going along your cervical spine, the top where your neck is, your thoracic, and then your lumbar spine. So nerves along that spinal part are spreading out to parts of the body. So wherever it gets pinched or obstructed or affected in some way is where you're going to feel the symptoms.
Gotcha. So if I'm a paratrooper 82nd Airborne and I jump out of a helicopter or C-130 or airplane and I land improperly, you could essentially develop radiculopathy from that as well as the back all in that one incident. Is that pretty accurate?
Sure, yeah, and you can also, develop knee issues, which then you have to compensate by forward bending or leaning back slightly or poor posture throughout your life, and that's going to result in the vertebrae maybe misaligning or getting out of position, causing then some pinching on that nerve root that's exiting at that specific bone, the vertebrae.
Right.
So just kind of think of it like that.
So we've done a lot of cases here in the firm where we have been able to take a veteran's back condition and create a secondary knee condition as well as a radicular pain as well. We haven't been very, very aggressive about the thoracic and cervical spine. If a veteran has a lower back condition, let's say rated at 10%, is it possible that that can cause a thoracic or a cervical issue, or is it the other way around where cervical and thoracic cause lumbar? How does that work up and down the spine?
I think it can really go back and forth.
Okay.
If you're having pain in your neck and then you're compensating in some other part of your spine, then that's going to then readjust and cause damage to that vertebrae, which then affects that nerve root.
Wow.
So it's kind of just the way that your body is making up for one or the other, affecting each other back and forth. So just kind of think of it like that.
Okay, got you. So, for veterans out there, the name of the game from a rating standpoint, and I'm a former VA rater, so I understand how to rate this to make sure you guys get your money and get what's due. From a rating standpoint, obviously range of motion is a big deal. So from a medical standpoint, how do you test range of motion? Because a lot of veterans feel they go into and I'm guilty of this as well. I went to a CMP exam, and as I walked to my CMP exam, the doctor says, bend over, go to the left, go to the right. How do you guys medically test the range of motion to make sure veterans are getting their percentages?
Yes, so the critical part is that you need to use a goniometer, which is a device. It looks almost like a protractor. So you're aligning up with the joint and then just moving it to the exact precise nerve angle or the angle that it's at. And so from there you can get a really accurate measurement that's consistent each time. And so the VA prefers accuracy and precision over just eyeballing the situation. So here at the firm we do use specific tools like that.
Absolutely. And so for a lot of veterans out there, they go to the CMP exam, and if you have experience where a doctor has eyeballed it, because the VA has made very clear to use specific tools to make sure range of motion is properly annotated. If you experience that, that's something you definitely want to communicate with us if you're our client, or with the VA if you're not our client, that this was done improperly. Now, of course, from a VA rating standpoint, I want to go into a little deeper detail about the percentages, because each back is rated differently, and each back condition also has a separate evaluation. And so, as I share my screen here, unfavorable ankylosis of the entire spine is what runs up and down your spine. Now, when it says unfavorable ankylosis, Dr. Nguyen, what does that mean in normal terms? I'm not a doctor, so unfavorable ankylosis, what does that mean?
Unfavorable means that you're not able to adjust your spine. It doesn't have like the normal curvature, so which then results in like some really severe symptoms like severe pain, numbness, nerve issues.
And ankylosis, what does that mean?
Ankylosis is a complicated term for the vertebrae being misaligned.
Okay, gotcha. So veterans out there, unfavorable ankylosis of the entire spine is a disability percentage of 100%. But if you have unfavorable ankylosis of the entire thoracolumbar spine, you're at 50%. Unfavorable ankylosis of the entire cervical spine or forward flexion of the thoracolumbar spine, 30 degrees or less, or favorable ankylosis of the entire spine is at 40%. 30% is forward flexion of the cervical spine of 15 degrees or less. And at 20%, you're looking at 60 degrees of forward flexion of the cervical spine, or 15 degrees, but not greater than 30. So that could get very complicated, but as you can see here in our document, this is where the VA rates it. A lot of our clients fall at this level of 20% or sometimes 10%, and that is typically the going rate for a back condition unless there is very egregious symptoms. So we'll scroll down here a little bit more, and you will see that there are diagnostic codes here to the left. Those diagnostic codes here, 5235, 5236, and so forth, is how the VA actually precisely rates your VA disability claim. And so if your claim has a condition of vertebrae fracture, that would be different than spinal stenosis, and that would be rated differently as well. Now, you can also have what's called degenerative arthritis or degenerative disc disease as well, that also be rated in conjunction with the range of motion of your VA disability claim. And so this here, as you can see, is a lot of great information. You can also see here on this part that there's a guide to show you that based on how you bend to the left and bend to the right, as well as rotate from the left and right, and also how you bend over in a flexion extension, will determine your actual range of motion, which then, of course, determines your VA percentage. Some of these terms are very difficult to pronounce, and if I mispronounce them, please excuse me. Bottom line here, name of the game here is range of motion, and your range of motion will determine exactly what percentage you will get with your VA disability claim when it comes to your back condition. Also remember that your back condition can also cause the middle back, lower back, and also the upper back, which is cervical strain. Your back can also cause radicular pain as well, and that's the shooting pain in the back of your legs. Now, for VA rating purposes, your radicular pain is rated in 3 increments. You have 1 being mild, moderate, and severe. Mild rates at 10%, moderate rates at 20%, and severe rates at 30%, and that is per leg. So it's huge for you veterans out there, if you're going in front of a CMP exam, you have a back condition as well as radicular pain, to express the level of severity being either mild or being severe or moderate. So I hope this helped you guys out in regards to your claim. If you're our current client, hope this coaching session also helps you out as well. Give us a call if you need anything else, and let's win.